Welcome to another episode of Healthcare Connections podcast, powered by Healthcare Compliance Pros. I am your host, Jeremy Winn. Our purpose for this podcast is to introduce you to key topics and experts in the healthcare industry to ensure you have what you need to successfully manage your practice. Please subscribe and follow us on our social media channels to make sure you don't miss any new episodes. If you have recommendations for guests or topics for this podcast, email me at jwin@hcp.md. With that, enjoy this episode of the Healthcare Connections podcast. Hello, welcome to another episode of the Healthcare Connections podcast. I'm excited to have Chad Schiffman on again. He's been on previously talking about med spas with us. And today, he is the Director of Compliance and Risk for us here at Healthcare Compliance Pros. We thought with the turn of the calendar year, we're recording this first week of January, we thought it'd be good to look ahead a little bit to 2025 and some of the things that we anticipate. But before we dive into what those topics are going to be, I just want to say, Chad, thanks for joining us again. Welcome to the
Hey,
podcast.
yes, sir. Good to be here.
Awesome.
Happy.
So 2025, over the next few weeks, we've obviously got a new administration coming in. And that always, anytime there's a change in administration in the executive branch, it brings some questions, some uncertainty. Sometimes people get concerned, or sometimes people are really excited about what's potentially happening. So I thought it'd be good to spend some time on that today. But also, there's been some recent news out there, and so I want to start with the HIPAA security rule. There were some recent updates and guidelines that were put out there by the current administration, and I thought it'd be good, Chad, to get your take on that and your thoughts on what you're seeing.
Well, I think with this most recent HIPAA security rule update that we saw to bolster cybersecurity efforts, a lot of that's probably due to the Change Healthcare incident, amongst other things that have been going on with some bad actors out there. And, and a lot of it's been a long time since the HIPAA security rules had any updates to it. So on one hand, I feel like these updates are very much necessary to bolster organizations' security posture within their practices. But at the same time, there are some proposed changes that might be a little bit difficult for healthcare organizations to fulfill as currently written. Uh, the one area that I'm particularly wondering how many comments they'll receive on is the need for a vulnerability scan every 6 months and a penetration test every year. Um, whereas a comprehensive security risk analysis has always been important for healthcare organizations since the inception of the HIPAA security rule, we just are seeing that, that being one of their top priorities every year or part of their enforcement activities, and now mentioned again in this proposed rule that that's going to continue to be as important as ever before for these organizations. So, uh, and then activities and things such as utilizing multi-factor authentication is going to be increased in importance. So is encryption. There is some clear language there. Uh, One thing that I found particularly interesting is they're going to do away with addressable and required. Everything's going to become more basically required with limited exceptions. That's one of the biggest changes that we've seen with the HIPAA security rules. So uh, it'll be interesting to see what those limited exceptions are and if finalized. Now, you did mention that there is a new administration, and it remains to be seen how this will go, what will be finalized and what types of comments are submitted. I expect there will be a lot of comments.
Yeah. As far as timeline on these things, how long does it take typically if they
Mm.
do, these rules do stick and the proposed changes become actual changes?
Sure.
What's that timeline typically look like?
Yeah, so 60 days is the expected, time for them to have comments received and for the final rule to be published. But again, that's going to happen with the Trump administration in office. And so will in his cabinet, I think it's important to mention there that, whoever's over HHS, which is RFK at this point, who who does he appoint, and what does that mean for OCR? And so it will remain to be seen what of this rule does get finalized. But some parts of it, sure, because I do feel like there is a need for the HIPAA security rule to be updated and increase cybersecurity. But like we've seen, and we'll get to this a little bit later, states under have always been high importance for the Trump administration to give some of that requirement to them. So we'll see what happens there.
Okay, so more to come on the security rule. Certainly watch that over the next, 45 days or so. We should get some more clarity, and probably we'll have to do a follow up conversation on that piece. The other one that has obviously raised some awareness and concern out there is around reproductive health.
Yes.
Additional privacy considerations around that. I'd love to get your take on that. This is something that I mean, it's been
Mhm.
challenged up to this point, but
Sure.
would love to just kind of where we at. What do you anticipate around that as well?
Well, the reproductive health care privacy update went into effect on July 24th of 2024. And then it was the goal was to strengthen the medical records and other health information related to reproductive health care. In fact, they issued an updated definition of what reproductive health care is as part of that rule. And while it's broadly defined, there are compliance expectations that were required as soon as December 23rd. Well, on December 22nd, there was a federal court in Texas, kind of the 11th hour, said, you know what, we're going to uphold the, the plaintiff's just, request to, uh, stop the enforcement against them. So it was Dr. Pearl and their practice that submitted this. And so Texas came through and said, well, for this organization, it's granted. It did not impact other regulated entities at this time, but with the new administration coming in, it's going to be interesting to see what happens. If there's going to be a more broad injunction against it, a different clarification, different update. We're going to be keeping a close eye out on that to see. But at this time, activities such as having an updated notice of privacy practices by February 16th, 2026 is going to still be required at this point, and we'll keep an eye out and issue guidance as we learn of it on this topic. So
Yeah, and so I think that's a good thing. 2026. For the amendment to the NPP, the Notice of Privacy Practice. So
mhm.
those that are listening, if you've got questions, if you are clients of HCP, certainly, we'll keep you updated as that happens, and we'll help you get those updates. If you aren't a client and you've got additional questions, we'll put our contact information here on the end, but reach out if you've got questions around either of those topics, the security rule or this reproductive health privacy um, situation. We're happy to help and dive into that a little bit with you. Thanks, Chad, for updates on those two kind of pressing issues.
Yes.
So we've talked about the new administration. You mentioned RFK. We've got Dr. Oz coming in,
Hmm.
and he's already made some comments that I think we should spend a little bit of time on, because I think he's tipping his hand on where his priorities might lie as he comes in um, to Trump's cabinet. He's talked a lot about wanting to increase the focus on fraud, waste, and abuse. And so I think it'd be worthwhile from your perspective, Chad. What are you hearing and seeing around those efforts of this new administration?
Yeah. So provided that Dr. Oz does get, that is confirmed into office, and
That's true. I guess, yeah. I guess it still has to happen officially, but
right.
I
Yeah.
imagine he's probably speaking maybe for the administration as well on that
Sure.
topic.
Sure.
So we could cover it even from that level.
Yeah. Yeah. And there's speculation out there if he is or isn't, but we'll just we're proceeding right now as if he is. Like all of this will definitely happen. Whether happens within the usual time frame or not remains to be seen. But we'll proceed as if he is. And with that, he has, and I don't know that it really necessarily matters whether he's in office or whether he's the one or it's somebody else, who gets sworn in. And, but he did make some comments that he would like to see a reduction in the fraud, waste, and abuse that's happening in the Medicare programs. And so, as the head of the Centers of Medicare and Medicaid Services, we can expect that that will be very important for them to come up with a way to ensure adequate monitoring and auditing activities are happening. And then I think we'll see that focus on, healthcare organizations just as well, plans, payers, and different things like that too. And so our thoughts are we're going to see a need for robust auditing and monitoring programs within practices, such as making sure that coding and documentation is up to date or accurate. I'm sorry, and supports what's being billed and those types of things. And if CMS is doing it, you can expect payers will follow suit. That's usually how it goes, and so that's one of our things that we'll be paying close attention to see what happens there. He has made other comments about the Medicare programs, and some people wonder if he's going to move to more privatization and different things like that. But what we do know is, at least on the federal programs that are there, we do expect increased monitoring and auditing to be a priority.
Okay. Which, again, we've seen that even prior to this administration, we're seeing more and more in that, especially, I've seen a lot in certain specialties, maybe getting
Mm-hmm. Sure.
more of a focus even this past year. And so,
Mm-hmm.
I would anticipate that continuing and maybe even going further. It sounds like
Right.
there's a chance of that.
Yeah, especially on those specialized, you know, procedures that practices do. We see a lot of scrutiny on those.
Yep, absolutely. So Chad Schiffman's tinfoil hat prediction. This will be fun. Let's hear, what maybe you think is going to happen this year and what to look forward to if you are in healthcare and running a practice. What do you need to be aware of according to Chad Schiffman?
My tinfoil hat, if I were to put one on right now, would say that states are going to have increased focus on privacy and security in the years to come, especially with Change Healthcare and different cyber attacks that have happened. And then we know that Trump has actually in the past made comments that he feels like some of these things should be state matters. And so we'll see. I mean, it is a changing year and there's a huge shift in the administration. So that would be one of my biggest ones. The other part would be that I know there's some concerns out there that compliance and risk may not be as necessary as before. I would say that that's completely opposite. I think they're going to be more important than ever before, especially as we navigate all of these changes. And so that would be my other tinfoil hat prediction: is that a need for a compliance and risk program is going to be paramount in 2025.
Awesome. Well, Chad, thank you for putting a crystal ball, together and kind of foreseeing the future for us. It will be interesting to see what happens with some of the uncertainty around the security rule and the reproductive health issues. And then, of course, with the new administration. So we'll have to revisit this in a few months and give some additional updates. But thank you for being on today, Chad. If you do have questions for us, Chad, you can email Chad, or you can also email me if you're interested in taking a look at what we can do when it comes to services and how we support healthcare clients. You can email me, jwinn, JWINN, at hcp.md as well. Chad, thanks for being on today. Appreciate your thoughts.
Yep, you're welcome. Bye.
Thank you for tuning in to this episode of the Healthcare Connections podcast. For more information on the topic we covered today, you can reach out to me or to our guest. For any additional information on healthcare compliance pros, feel free to email me at jwinn@hcp.md. Don't forget to tune in next week. Thank you.